This is RTV6 News at 5:30, working for you.
And now at 5:30, safety precautions in the age of coronavirus. What it means for first responders who are often dealing with the unknown.
The newest way to help young people in the classroom. One of two therapy dogs joining the team here in Franklin. I'm Rafael Sanchez. That's what's coming up on RTV6.
Here's what we're talking about today in our lineup. The number of complaints about workplace safety, they're going up and they're expected to keep going up. The protections that you have, where this may fall short, also this.
They're just kind of left in the dust, to fend for themselves like this.
Family members are feeling helpless as COVID-19 cases rise in prisons. We look at the issue in the state with the most cases in the U.S. And it's a positive side of this pandemic where renters are seeing record-breaking drops in prices.
And first at 5:30, coronavirus means new ways of dealing with safety for all of us. For those coming in contact with COVID-19 patients, possibly before people are even diagnosed, those safety precautions are key. RTV6's Alyssa Donovan found out what the Carmel Fire Department is doing to be prepared when responding to calls in this new era.
As we deal with daily changes with COVID-19, first responders with Carmel Fire Department are doing everything they can to keep themselves and you safe. This is the new normal for firefighter and EMT Matt DeRiker. Putting on protective pants, a protective jacket, an N95 mask, and glasses before every run. And when they arrive to the call,
if they come out and they have symptoms that are typical of a COVID patient, then we're only sending 2 people in as opposed to what we usually did when it was 6.
After they return to the station, they spray down themselves and their equipment with disinfectant.
We pretty much spray the entire inside of the bus, and then we take the sheets off and we spray the entire cot down, and we wipe off all of our electronic.
These are some of the many steps the Carmel Fire Department is taking to keep their crews and you safe.
Did a really good job of just focusing on what we're going to need first and then for the long haul.
The department stocked up on PPE like N95 masks, gowns, paper masks, disinfectant, and hand sanitizer. They're also doing a temperature check anytime someone enters the building.
Well, I feel safer.
And each firefighter is getting tested weekly for COVID.
The first couple weeks was a little strange having them tickle the back of your head.
A test that is not only for their safety, but for those they're serving in the community.
We're not just going on COVID patients, we're not just going on fires, we're going into the homes of the people that are very sickest. So if we can find out early and often that somebody is possibly positive and then keep them out of that equation until they're safe to go into it, it's going to help keep the citizens safer.
Fire officials are keeping an eye on trends with the virus to determine if any changes will need to be made to the protocols. But for now, this is the new normal for crews working in Carmel. I'm Alyssa Donovan, RTV6.
Thanks, Alyssa, and we are going to be listening for some thunder later on this evening and watching Storm Team 6 radar. All is nice and quiet here in central Indiana for the moment, but as we look at the radar, you can see there is a line of thunderstorms back into portions of Illinois, and as we time those out, would reach the state line about 8 o'clock tonight, and there is a potential that some of those could be strong to severe. That marginal risk over the western half of central Indiana, primarily for some gusty winds and some large hail in a couple of those storms. Right now, we've got those overcast skies, a little bit of sunshine trying to peek through with that temperature of 86. We've got that south breeze. It's gradually going to be bringing in more humidity over the next couple of days, and it is bringing in some warmth to Bedford at 92, while it's 87 in the Muncie area. Your evening planning forecast, we're going to be pretty quiet here for the next couple of hours with those temperatures in the 80s, but the increasing storm chances, and we'll take a closer look at that with TrueCast in just a few minutes. Chris?
Concerns about what the Trump administration will do with COVID patient information. The White House has ordered hospitals to bypass the CDC and put information into a central database. There are some health experts worrying that this information will now be politicized. Well, health experts are working on how to best use COVID testing moving forward. An epidemiology professor says that we've come a long way in increasing the number of tests, but this virus is moving faster. Labs are again getting backlogged, with results taking days.
If we're going to look to testing as a way to stop this virus versus just sort of brute force close everything down again, I think that we need to absolutely focus on getting turnaround times quicker, within minutes, not days, and definitely not weeks.
Michael Minnis says that taking tests from states with a surplus to then states that are seeing spikes, it's not a great option because shipping the samples to labs to get results just adds more time to the process. But manufacturers have made a lot of progress with point-of-care tests that can offer results immediately.
Somebody finds out that they're positive, then they go and they self-quarantine and they continue using these sort of at-home tests, for example, until they become negative.
The CDC director is also looking into testing everyone in one community that is seeing an outbreak.
We are going to need to be more innovative. I do think we're going to have to look at some of these broader community-based testing strategies. I think but that's not for us to throw away the importance of traditional diagnosis, contact tracing.
Robert Redfield says the problem with contact tracing is it doesn't work well when much of those infected aren't showing symptoms. Now, George Floyd's family suing the city of Minneapolis and the police officers involved. The announcement coming today from their attorney, high-profile attorney Benjamin Crump. He has won several other police brutality lawsuits. Attorneys claiming the city allowed police training and action that is unconstitutional and marginalized black men for years. Now, this is a civil lawsuit. It's separate from the criminal case against the 4 police officers charged in Floyd's death. They say the lawsuit is more about accountability than it is about money. All right, let's get back to our lineup. And the federal agency that is supposed to protect you when you're on the job is seeing a growing number of complaints about safety issues related to COVID-19. The protections it is recommending, where they may fall short.
Tonight, Metro Police are asking for your help as they try to gather info in a deadly shooting on the downtown canal on July 5th. They just released several pictures that include people police say could be witnesses to the crime or persons of interest. They were walking north on the east side of the canal from Indiana Avenue. The shooting happened around 3:30 a.m. Sunday, July 5th. 24-year-old Jessica Dottie Whitaker later died at the hospital. If you have any information that can help police with this case, call Crime Stoppers at 317-262-TIPS.
More businesses are making masks mandatory. Sam's and Walmart announcing today customers will be required to wear them inside all their stores starting on Monday. Walmart's created a new position to specifically handle interacting with customers who don't have masks. Now, they said that they're considering different solutions for customers who don't have a face covering. Sam's customers will be offered a complimentary mask. Now, complaints are growing nationwide about workplace safety issues related to coronavirus. OSHA's received more than 6,500 nationwide on a federal level since February. One trial lawyer who works in employment law says that she expects that they'll keep going up.
Where I really think the numbers are going to escalate is in the retaliation world, where employees bring issues to their employer's attention about, failure to implement appropriate administrative or engineering controls or social distancing measures, and then they feel that they have suffered an adverse employment action as a result of bringing this to their employer's attention.
OSHA recently updated its guidance on COVID-19 related workplace safety. It now suggests wherever possible and feasible, employers should require masks at work. Now, the guidance is something the lawyer we spoke to says everyone was waiting on. She says for states or cities that already had a mask mandate, it was easier to enforce at work. But for states that don't have the mandate, it was harder until now.
At least you can now turn to CDC guidance and OSHA guidance as an employer and say, look, even if you disagree with us for political reasons or personal expression reasons, we're following the guidance from agencies that are meant to look out for your health and safety.
Now, still, there are concerns OSHA isn't going far enough in other areas. A big criticism among employee protective organizations, workers' organizations, and unions is that OSHA's guidance on COVID-19 isn't a regulation and doesn't really have any teeth. Virginia and Oregon are 2 states looking to fill the gap with their own worker protections. If you see issues in your workplace, the employment lawyer recommends being reasonable in your approach, not getting too emotional in your reaction. She says also keep careful documentation about who you spoke to and what you talked about. All right, let's check back in with the lineup. We know rent is expensive, where some people are able to talk down the cost right now when they re-sign because of this pandemic. Rent. For many Americans, it's the biggest bill. But as this pandemic continues, Kai Beach shows us how major cities across the country are now seeing record-breaking drops in rental prices.
We've seen some falling prices and people not getting what they got a year ago.
Property manager Brandon Schulten is seeing big price drops in some of his listings.
We're at $3,040, but we started up above $3,300.
Demand for units like this 2-bed, 2-bath in downtown Denver are cooling off since COVID-19 hit.
Great for entertaining here. And
Schulten says many of his rental properties are staying on the market 20% longer, while prices have dropped nearly 20% compared to the same time last year. And he believes the plummet is linked to the pandemic.
Especially with so many remote work options now and that kind of thing, I think all of it's going to just push that pressure outward a little bit, and you'll see prices fall kind of in the urban corridor.
What Schulten is seeing in downtown Denver is happening to other major metropolitan areas across the country.
The pandemic has shifted the demand for rentals away from these really expensive areas.
Crystal Chen is with Zumper, an apartment rental tracker. Her company's recent national rent report found one-bedroom rent prices in San Francisco fell nearly 12% year over year, the largest drop that city's ever seen.
It makes sense. Why would people want to pay like a big city price tag if they can't use the amenities and they're stuck at home? And so people are negotiating down, like 10, 15, even up to 20% now because, there's so many more vacancies now than there was before.
Without a vaccine, Chen predicts rental prices in downtown areas will continue this downward trend as the demand shifts from cities to the suburbs. I'm Kai Beach reporting.
Kai, thank you. And most of those that were looking into buying a home, well, they've either ended their search altogether or they're going to wait more than a year. That could be in part because housing prices continue to climb and are forecasted to go higher. Zillow also reporting there are fewer deals to be had. New listings of high-end homes are surging, and all houses are sitting on the market for fewer days.
2 therapy dogs will be on duty within the Franklin Community School Districts when more than 5,000 kids return to classes on August 5th. This is Millie, the 9-month-old, and her fellow canine hero will assist in providing mental health care services. A special focus will be on the social and emotional needs in the classroom. They are just so cute. Oh my goodness. Please take a look at them. They're just darling. And they're going to be helping in the classroom from a child having a meltdown to one coping with a personal crisis.
This is just one of the ways that we are bringing that kind of additional support to our students in the classroom.
Well, the dogs are funded as part of a referendum passed by voters to improve teachers' salaries and invest in mental health care. Kyle.
Well, you may have heard the buzz on social media about a comet, and you actually have the chance of seeing it for yourself here in central Indiana the next couple of nights. As we look at this planning forecast here, we are going to be talking about seeing that comet, at least the viewing window, a little after 11 o'clock at night and then lasting about an hour and a half or so, but you'll look low on the northwest horizon. Problem is for tonight, we've got those clouds and associated thunderstorms. So I think Thursday and Friday night's going to be better chances of seeing that comet fly through the night sky. Here's a look at those thunderstorms and the more immediate concern for us. By 10 o'clock tonight, we've got those thunderstorms moving into the western portion of the state. And as we go through the nighttime hours here, I do think it will continue to weaken as it progresses toward the east. However, we'll likely have a couple of thunderstorm warnings anyway, so make sure you've got the Storm Shield app loaded on your phone. It is free, and we'll send any of those warnings for your location right to your phone. Forecast tomorrow, we'll hold on to the chance for a few showers and storms into the morning hours, but as we go into the afternoon, mostly cloudy skies, a little more humid, although temperatures will stay in the 80s for that afternoon high, looking at about 86 in Greenwood, 85 in Lafayette, and 87 in the Columbus area. The heat, though, it will build heading into the upcoming weekend. We are back in the 90-degree club Friday through Sunday. In fact, as we get into the weekend, we could have those heat index values topping 100 degrees. 7-day planning forecast for us, and we've got those small chances for showers and thunderstorms here as we go into the upcoming weekend. And then next week, it looks like we will have a front in the area that brings us the better chance for some more widespread rain and also brings those highs out of the 90s. Chris?
Prison systems across the country are learning as they go as they manage coronavirus outbreaks among inmates. Jamal Andrus with our partners at Newsy taking a look at building concern among inmates' families, including one in hard-hit Texas.
In Texas, COVID hospitalizations have jumped by more than a quarter over the past week. Some of the worst outbreaks in the state are concentrated in prisons and jails.
It's just a scary feeling that he's worried about us out here. You know, and we're worried for him in there.
Adriana Varial's father is being held at the Stiles unit in Beaumont, Texas, which has the second highest rate of active cases in the state. Varial says her dad tested positive for the virus and has been on lockdown for weeks.
They're just kind of just left in the dust, to fend for themselves like this.
Along with the Beaumont prison, there are major outbreaks in San Antonio and East Texas facilities where active cases are at more than 490 and 780, respectively. Carrie Blakinger from the Marshall Project has reported on several problems throughout the Texas prison system in connection with COVID-19, from terrible food to dead bodies in prison cells.
So I think that the mood of the people I'm talking to is sort of varying degrees of desperate and terrified.
The Texas Department of Criminal Justice started widespread testing in mid-May after 30 inmates with the virus died. Since March, the ACLU of Texas has been sending advocacy letters and has filed multiple lawsuits aimed at reducing the number of incarcerated people throughout the state.
The number one step is that you really have to reduce the population of these facilities, because in so many places, social distancing is just completely impossible. Then once people are sick, it's very, very difficult to contain and provide adequate treatment and medical care.
But rather than take steps to reduce the number of people behind bars, Texas Governor Greg Abbott signed an executive order limiting who could be released pre-trial from county jails. As it stands, Texas has more total coronavirus cases amongst the state's prison population than anywhere else in the country, leaving family members of those prisoners feeling helpless.
We care about my dad very much. I love him. I would hate for something bad to happen to him in there.
Jamal Andrus reporting.
Jamal, thank you. Now, we are continuing to look into how COVID-19 is impacting minorities. There is some new research through an American Heart Association grant on how this virus is impacting Black women. Now, we already know that COVID outcomes are related to pre-existing and socioeconomic conditions. Black women are at the intersection of the worst health and economic disparities, and they're also often essential workers, breadwinners, caretakers for children and elderly relatives. So the goal is to drill down on which of those are having the greatest impact.
Is it the delay in getting testing? Is it due to many folks being in the same household? Is it a combination of those things?
Dr. Michelle Albert is president of the Association of Black Cardiologists. She has spent her career looking at how racism and discrimination affects the body. In past research, she has found Black women experience higher amounts of toxic stress than other women.
It is prolonged and it results in wear and tear on your body's biological systems, making it easier to develop things like heart disease.
Dr. Albert says health is tied to wealth, and both of those are tied to educational opportunities. Everyone can play a part in breaking down structural racism and health inequalities by paying attention to local school districts.
If your local school system is not racially or ethnically diverse, you need to ask why, and then relentlessly pursue the answers to that question.
Dr. Albert points out that 80% of a person's health is dictated by social factors, while 20% is genetics. All right, we have a final check of our lineup for today. A lot of businesses that thought they'd be covered with their insurance when the pandemic hit weren't. So we're taking a look at some of the new products that companies are working on to protect businesses moving forward. Many businesses didn't have the insurance coverage they thought they did to protect themselves when the pandemic started. Now companies are working on new products to make sure they can be covered in the future.
The world in general was not thinking about pandemics or non-damage business interruption or that whole class of problem before February, right? But come next January, February, they're all going to be thinking about it. So everyone has to scramble and find some type of solution.
Boston-based tech firm Machine Cover is a business that's working on a solution for insurance companies. It provides the technology for parametrics, it says, is a simpler way to address risk. Now, the company uses satellite photos to measure traffic levels around businesses. Now, with this system, if the traffic drops below a certain level, like in a lockdown situation, then your insurance would pay out. Instead of just relying on losses like the current system, it's a way to determine objectively who gets what.
With a parametric, it either triggered or it didn't trigger. If it triggered, you get the money, and if it didn't trigger, you don't get the money. And if you bought a pandemic for $5,000, you get $5,000. If you bought it for $25,000, you get $25,000.
Machine Cover's offering this technology to insurance companies. It doesn't set the price, but says it's suggesting that they don't charge more than 10 or 15% more than what businesses are already paying. Now, another company, California-based Elite Risk Insurance, is now offering COVID outbreak relapse coverage. This is targeted at businesses with multiple locations and covers situations like if a business reopens but then has to shut down again due to a COVID case, or the city saying that certain businesses need to shut down. Company's founder tells Reuters this insurance is expensive because it covers a risk that doesn't have a historical basis for calculating the price. Healthcare professionals say each month Americans are asked to stay home, meaning more doctor's appointments are canceled.
People don't want to go to clinics, right? People don't even want to go to grocery stores.
Sometimes a simple doctor's visit can spot big problems early on. So tomorrow, how some physicians are bringing back the old-fashioned house call.
Thanks, Chris. And we are keeping an eye on thunderstorms in Illinois, a tornado watch there, and also a tornado warning on a storm that could impact Benton County. Kevin will have much more on that. Temperatures are going to be rising here as we go through the next couple of days. We are back in the 90s for the weekend ahead, even 95 as we go into Sunday with even higher heat index values. Thanks for joining.